Okay, whenever you're ready.
Shy. I really don't want to.
Okay, whenever you're ready. Whenever you're ready. Okay, whenever you're ready.
Okay. It's rolling?
Yep.
Okay. My name is Kristina. I'm an American citizen living in Florence, Italy. I've been here for 8 years now, and my first experience with the Italian national healthcare system, which is a public system that everybody here is entitled to, was giving birth to my child, who is now 5 years old. All of my blood tests were free, all of my ultrasounds were free, all of my doctor's visits were free. And when I got to the hospital, when I was in labor and got to the hospital, they took me in and immediately saw me, and I didn't have to worry about presenting any paperwork or just my name and my identification card. And I was immediately treated and taken very, very good care of. This past spring, I came down with a bad case of the flu, and I had called my doctor to make an appointment, and this was a Monday, and his next available appointment was on a Wednesday, so I was going to wait to go see him. Well, I was extremely weak, and when I tried to get out of bed, I collapsed to the floor. So we immediately called him, and he made a house visit. He came to my house within a half hour. So he came immediately to my house and checked on me and decided that I needed to go to the hospital because my blood pressure was very low, and he wrote up a prescription and called the ambulance, and the ambulance came and picked me up. So they immediately accepted me and treated me, got me hooked up to an IV, took my blood to make sure, took blood tests to make sure that that everything was okay, and just took care of me. They were focused on my health, and I never had to give any paperwork. I just had to give my identification and the prescription that my doctor had written up. So as a follow-up visit, my family doctor actually came back to see me again because the symptoms were persistent, and I continued to have a fever even after the hospital visit. So he ordered blood tests, and because I couldn't go to the public facility and have my blood test immediately, have my blood taken immediately, we called to have a private company come in to my home that day and take my blood. And I think we paid, because it was a private service, we paid something like €18 to have that done. And because it was an emergency, the results were going to be ready the next day. When I arrived at the hospital, they just asked me what my blood pressure was, and what they didn't ask me if I had insurance. They didn't ask me how much money I could make a down payment for that day. Although I'm a legal resident, I'm not an Italian citizen, I still have rights to, and am entitled to all the healthcare benefits that Italians are entitled to, and I can receive all the treatments and medical attention that I need, and I don't have to worry about paying for it.